The following segment is sponsored by Oakview-Medical-Associates.
For some people trying to lose weight, the strategy of intermittent fasting seems appealing, but how does it work and is it safe? Dr. Nita Bijoor is here from Oakview Medical Associates. Hi, Dr. Nita.
Hi, Margaret.
February is intermittent fasting month, and a lot of people are not sure exactly what it entails. So how do you explain it?
So to keep it simple, intermittent fasting is basically not eating for certain defined periods out of the day. There are many types of intermittent fastings, but the simplest one is to decide a period of time that you will stop eating and then when you will start eating. So most people find it easy to do in the evening after dinner, and anyway you're asleep, at night, so that counts. Those hours count as a fasting time, and then you can break the fast in the morning or mid-morning.
Okay. So there's flexibility there. One concern people have is that fasting would slow their metabolism down. Is that the case?
No, not really. It should be really done under the guidance of a physician familiar with what intermittent fasting is. Usually what happens is when we eat some food, the carbohydrates, the glucose in the food gets taken in intracellularly into the cell by a hormone called insulin, which acts like a key on the cell and lets the glucose and the carbohydrates come in, and it gets stored as energy in the fat cells. When you fast, what happens is there's no carbohydrate outside. You haven't eaten sugar or eaten a carbohydrate meal. Insulin stays down. It stays very dormant. And when that happens, the cell starts to release the stored fat energy for use for workouts, for your daily function. So fasting actually is embedded in our evolutionary physiology because it really helps your cells get some rest, and then it helps burn fat very easily.
Okay, interesting. Well, are there any misconceptions people have about intermittent fasting or anything, your thoughts about it overall?
Yeah, I think it's great to incorporate that into it. It not only helps you lose weight, that's one thing, but it actually helps your metabolism. It helps improve your BMR, contrary to popular belief. I get questions all the time from, perimenopausal, menopausal women, and also men going through low testosterone as to how do I incorporate intermittent fasting? How will it help me? It's not just important to do it, but it's also important to do it right in the right time frame of the day. We call that circadian rhythm fasting. So there are a lot of things. I think there's a lot of awareness on the internet, but there's also a lot of misinformation. If you really want to know, you should seek a physician that's familiar with what intermittent fasting is and how it can help your individual goals.
Absolutely, because they can be tailored to the person specifically. That's how you would do it. So nobody should embark on any major dietary change without talking to their doctor. Meanwhile, health and nutrition, a big part of what you do at Oakview Medical Associates, your lifestyle medicine. Tell us about it.
Yeah, so, what it boils down to is what are your goals for your health, and then communicating that to your physician, that's us. And we really work with the patient to define that and to make it into actionable steps so you can achieve it. Whether you have high blood pressure, diabetes, or you want to lose 40 pounds, we start with a very good baseline evaluation and then help you realize each of those goals. So it's not just intermittent fasting, but also what kind of food are you eating? Are you eating a nutrient-dense diet? Try to stay away from calorie-dense foods, incorporating the right type of exercise. Weight gain is very hormonal, very age-related, and it's also related to your epigenetics or environmental risk factors. So we work well with our patients to kind of identify factors in their life that are mitigating the weight loss efforts and really come to a very workable solution that's sustainable for them. And being board certified in bariatric medicine, I really focus on the whole aspect of the patient. It's not just what you eat or how much you exercise, but it's also your sleep and what stressors are you letting affect your daily routine. And then are you surrounding yourself with positive social connections? It's hard to lose weight and to take good care of yourself if you're not surrounded by people in your family doing the same thing.
Well, you can help people tackle all those areas. You work alongside them doing it. Oakview Medical Associates, located at 11 Five Forks Plaza Court in Simpsonville. The number on screen, 627-0444. Dr. Nita Bijoor from Oakview Medical Associates. Thanks so much for being here.
Thank you.